Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be discussing diabetic neuropathy and foot care. So first, let's dive into what diabetic neuropathy is. Diabetic neuropathy is nerve damage caused specifically by diabetes. This is one of the most common long-term complications of diabetes. So diabetic neuropathy affects the peripheral nervous system, autonomic nervous system, or potentially even the cranial nerves. This neuropathy is thought to occur due to accumulation of sorbitol in the nerve cells. So for those of you wondering, what is sorbitol? This is a byproduct of improper glucose metabolism. When there is an accumulation of sorbitol, there will be abnormal fluid volumes, an electrolyte shift, and a nerve cell dysfunction. So now let's discuss what are some risk factors for an individual to develop diabetic neuropathy. These factors include the severity of diabetes diagnosed and the length of disease, elevated triglycerides, higher body mass index or BMI, smoking, and hypertension. So sensory impairments are more commonly seen as a first complication for peripheral neuropathy, and autonomic signs and symptoms more commonly appear later on in the disease progression. There are several types of neuropathy, which include sensory, motor, and autonomic. So sensory neuropathy will lead to an absence of pain and pressure sensation. This can lead to risk of skin breakdown. Mechanical and repetitive stresses commonly lead to additional wounds or ulcers due to this decreased sensation and inability to detect these stresses. So now, motor neuropathy leads to loss of intrinsic muscle strength, foot drop, or hammer toe and claw toe deformities. This can lead to risk of skin breakdown due to poor weight distribution and wearing or rubbing from shoes. And finally, autonomic neuropathy will lead to dry and inelastic skin due to diminished ability to sweat and produce oil. This can also lead to skin breakdown, injury, and heavy callus formation. So as mentioned, these various neuropathies can lead to wounds or ulcers, which most commonly occur on the weight-bearing surfaces of the feet, and primarily rounded or areas with bony prominences will be affected.
Now let's look at the examination process. Sims-Weinstein, also known as monofilament testing, is used to assess a lower extremity protective sensation. A 4.17 or a 1 gram of force monofilament can be felt by an individual with normal sensations. A 5.07 or a 10 gram of force monofilament can be felt by an individual with intact protective sensations. A patient can be at risk of a foot ulcer if they have loss of protective sensation, which is dangerous due to the lack of sensing of the foot trauma. This will be most commonly seen in a patient with long-standing diabetes. The Wagner classification of neuropathic ulcers is a valuable, very valuable source that you should really understand for this examination. A 0 is a no open lesion, which may have deformity or cellulitis. A 1 is a superficial ulcer. 2 is a deep ulcer to tendon, capsule, or bone. 3 is a deep ulcer with abscess, osteomyelitis, or joint sepsis. 4 is localized gangrene, while 5 is gangrene of the entire foot. The intervention is always important to understand so that you can treat your patients properly. Comprehensive diabetic foot care education, wound care, controlling that blood glucose level, and also offloading the foot, exercise, and modalities are all very important. When it comes to diabetic foot care, it's key to keep in mind that both feet should be undergoing screening. Wash, do not soak the feet daily in warm water. Keep toenails cut straight across. Clean white socks should be used while avoiding wrinkles. Alternate shoes while making sure that they fit properly as well. Now that you understand diabetic neuropathy and foot care, here is a quote from Dr. Seuss. You're off to great places. Today is your day. Your mountain is waiting, so get on your way. That's right, warriors. You have so much ahead of you. That mountain is right ahead of you, right in front of you, so go get it. Don't hold yourself back. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.